can't even bend any finger. You see, I do not have any injury and I can just lose the joint quality just like that. So if you know somebody lying on the bed in any hospital, if you feel like doing something, move the joint. When you move the joint, the fluid will get rotated and that will give signal to the brain, I'm employed. When I'm employed, the fluid will retain there, or maybe the will request more. Will request more. Or maybe waking up for it was 2:30. Yeah? So it will invite or it will request, I need more fluid. Can you send more fluid to me? Sometimes when the joint is not enough, you will get more fluid in. So it depends on how much do you move. Okay? Okay, are you ready? Now we go to the next. Let's look at the muscles in the joint. Very important, there are 4 muscles that we need to know. So don't worry about the names, but we call it rotators. Rotators means you rotate them. Because you want to correct your collar, or you want to put your pants nicely, or you want to adjust or something, you know. It's not always the hand, shoulder don't move like that. We don't always carry things like that, and we want to eat also difficult, we must bend. So it must rotate. Shoulder must have rotation. No rotation, you are in trouble. Earlier, before I show you the muscles, earlier the joint is, this is the glenoid, this is the joint. Joint is basically hanging, if you notice. This portion, there is no cup there, no. There is no cup there. It's basically hanging. The joint is hanging. If anybody touch or hit you from up strongly, you will get dislocation. Be careful. Yeah? But then, God didn't design so fragile. It's very strong. You really need a Mike Tyson to do it. Okay? Alright, let's look at the muscles now. One muscle is known as supraspinatus. There is one spine I want to show you. Another one is known as infraspine. Supra means above, infra means below. So when I show you the spine, you will know already. Above means supra, below means infra. One is teres, don't worry about this one. They are Roma teres. And another one is sub. Sub means under scapula. The bone just now I told you most important bone is known as scapularis. Now let's look at this picture first. Never mind, we look at this first. Can you see the spine here? This is known as a spine. This is scapula bone just now. It's like an African one. So you have a shape of Africa here, and this item that is crossing by, we call it as spine. Above it, we call it supraspine. It's a small muscle that attach on top of that humerus cage. You see how they are linked? They are just crossing over and linked like that. Very important to see this muscle nicely. Next one is known as infraspinatus. Infraspinatus can be seen both sides. This is, I'm looking from the back. If you are looking from my back, okay? This is how the picture looks like from the back. Right? This is infraspine. Next one is teres minor, a small muscle. There's another one known as teres major. Doesn't play a big role, but it has its function. But this is teres minor. A lot of pain right here, yeah, underneath the armpit. And last one is sub. This is scapula. Now if I see from front, removing my ribs, I want to see where is the other muscle. The most important muscle is subscapularis. This bone name was scapula. So underneath that scapula is subscapularis. This is seeing from front view. This is seeing from back view. So seeing from back, you got 3 muscles there to handle. From front, you got 1 muscle to handle, but I can't even touch. I cannot cross to the ribs. So you can't meet the subscapularis, but you can only meet the head. So the head is the place where you can feel the pain. Because when we press down, you normally will scream. It's pain, real pain. That indicates the muscle is not healthy or something is not right. Forget it if you cannot remember, but you know there are 4 muscles make up one rotator. To rotate, you need 4 of them to involve. I show you later. Let's touch a bit more. Muscles in the shoulder, not only that. This was rotators here just now. The rotators are here. There are so many other muscles attached. underneath, and every other place. The aim to show you this slide is not only that, there are so many others, but the core one was rotators. Okay. Now, these are the rotator cuff, if you see in clearer picture. Yeah, the rib. After the rib is which muscle? If you can remember? Subscapularis. This is the one that nobody can touch because I cannot go in front here. It's difficult to meet. I can only meet this guy the moment you carry your hand high. I'll meet a small border of the side. So it's not easy to meet with that. But this is the main pain maker. Yeah? And it's actually taking majority of your space here. Now, I want to show you one more thing from here. You have known all these muscles already. You know this is clavicle. You know the acromion. This is the joint. At the joint, bone and bone normally attached by a ligament. Ligament, whole bone. The moment I can move my hand like that, free, without pain, and I can come back to the origin because my ligaments are strong. Ligament hold one bone and another bone very tightly and flexible. But if I hold it too long in one position, normally they say about above 3 minutes, then I tend to lengthen the ligament and I might cause some sprain. So you might have a small pain, like discomfort, like for the day. But if you that kind of sprain, you can always apply ice to reduce it. Are you okay so far? I'm not making you a surgeon. I'm just sharing what is a shoulder, normal shoulder is. I will show you the disease. Okay, this is normal shoulder. Okay. Now I want to reverse the slide. Most important portion of this thing is this portion here, the capsule, the place where we call it glenoid humeral joint. If we enlarge it, we focus it deeper, it is normally covered by a very strong labrum. This labrum prevents the fluid from coming out. You really have to break the labrum to let the fluid out. Not easy to get it out. So if you hold your fluid very tightly inside, and that's the reason your shoulder is strong. Not easy to disturb it. Protected by the superior portion is protected by this bone. They are protecting actually. All of them have its own role. They are protecting. You can't damage it in any portion, but you need to look after them. This is the muscles that you bend your elbow. So it's also ending here. That's why some people feel pain when I make it straight. Okay. Are you okay so far? Looks like we're going to go year 1 medicine already. This is anatomy. Okay, let's look a little bit on the tendon and the ligament involved in the shoulder joint. This is how we study. We study inside was so many things. This is you are looking at my shoulder from this view now. Just now you saw it from here and you saw it from behind. Now you are looking from sideways like that, removing my shoulder, my humerus, and see what is inside the cavity. See how they are being attached. This is your biceps. Just now I show you that you bend your elbow. And then this is your glenohumeral superior, glenohumeral middle, and this is inferior got 2. So they are very strongly attached inside, so you cannot simply get a small injury. Look at the designer, he know how to make all this. And your shoulder, my shoulder, same. No more experiment, no more testing. Confirm same. Okay? And number 6 one is here, which is a pouch that is holding the whole labrum. I was telling you about the labrum. This makes up the whole labrum. Now, let's understand what a normal movement this shoulder has. This shoulder has flexion. Flexion means I'm bringing my hand front way up. Okay? Front way up. Shall we do together? Can we get up? Just distance yourself little bit front and back. Okay? Front way up is, it's important to keep your 2 hands front way with your tongue going forward up. Your highest point will be your ear. Can you beat your ear? That is where your normal point is. So your target is to cross your ear. So I would advise you to do daily 10